My name is Carmen. I'm going to be performing a basic assessment. I have washed my hands and introduced myself to the patient. Can you tell me your name?
Sarah Payne.
And where are you?
I am in the clinic.
Why are you here?
To be assessed.
And can you tell me what day it is?
It is August 25th, Saturday.
Perfect. So the patient is alert to self, time, place, and situation. The patient is dressed appropriately for the weather outside and season. The patient has a calm mood and affect is appropriate. So the next thing that we're going to do is we're going to just take a general look at her skin. Her skin, I'm going to touch here, is warm, dry, and she has no obvious rash or lesions. We're going to look at her skin trigger here. It is quick and elastic. I'm going to check her cap refill. It is less than 3 seconds. And moving from there, her texture of her skin is in good condition. And going from there, I'm going to start with her head. Her hair is distributed normally throughout her head and on her arms, upper extremities, and her lower extremities. Now we're going to assess her facial sensations. I'm going to have you close your eyes and tell me left or right and then sharp or dull.
Left, soft.
Let's do this. I'll do it on the other end.
Right, sharp. Right, soft. Left, soft.
Good. So the patient has good sensation in her face. You can open your eyes down. We will go ahead and assess how the patient smile. And close your eyes real tight. Lift your eyebrows and puff your cheeks. So patient is symmetrical and in her face and intact. Now we're going to move on to the eyes. I'm going to have you look at the pen light and follow it and keep your head straight. Good. So we notice no involuntary movement of the eyes and everything moved appropriately. So the next thing I'm going to do is follow the pin light. It's going to move towards your face. Good. So there we're just checking for accommodation, and the patient's eyes were easily able to accommodate the movement of the pin. So now I'm going to have you look straight ahead, and we're going to assess the light. And the patient has approximate 4 millimeter pupils. And the patient's pupils are round, equal, and reactive to light. So moving on from there, we're going to, I'm going to have the patient open her mouth. And her mucosa is nice and pink and moist. And from there, we're going to, now that we've done the face, eyes, and mouth, I'm going to have the patient, I'm going to assess her shoulder shrug here and have her move against me. Good. And then we're going to assess the sternocleidomastoid and the patient turn to the right. We're assessing here and have her move against me. Good. And the other side, that side. And we're assessing here and move against me. Good. And while we're here, we're going to look at the patient's trachea. The patient's trachea is at the midline and symmetrical. It has no shift. so within normal limits. And now we're going to assess, I am going to assess her fingernails for cyanosis and clubbing. She has polish on toes, but you can see that they're still warm and no clubbing. And the next thing I'm going to do is I'm going to assess the patient's lungs. So we're going to inspect her thoracic cavity, and we can see that the patient has a symmetrical chest here, and her configuration has no barreling or flailing noted. And so then after we've looked at it, we're going to listen. So I'm going to have the patient deep breath. Good. Good. So now that we've done that, the patient's going to stand up and turn around. And we've also noted that the depth of respirations are good. The patient has ease of breathing and her rate is regular. We're going to have the patient take a deep breath. Actually, I'm going to go up here. Here, 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 here. Then here. And here. Good. And then when we inspect here, we see again that the patient is symmetrical and no work of breathing noted. I'm going to go ahead and palpate for any tenderness. And the patient has no tenderness there, no masses. I'm going to have her turn around and do that on the front side as well. And good. So the patient has no tenderness and no masses noted, so you can sit. And the next thing we're going to do is I'm going to listen to her heart. We will start with the aortic and pulmonic and work our way down. We're looking for her clavicle line and the second intercostal space down for the pulmonic. And then when we get to the apical pulse, we are going to go to the fifth clavicle line, or fifth intercostal space, mid-clavicular line. Up. And we would listen for 1 full minute and note that this is also the point of maximum impulse. Patient has an approximate rate in the 60s and a regular rhythm. So now that we have assessed the chest and lungs, S1 and S2 were easily audible. Oops. And no murmurs or thrills noted. Respiratory rate is also noted when listening to the heart to be within normal limits around the rate of 14. The next thing we will do is we will have the patient lie down. And so we're going to go ahead and start with the abdomen and do, I'm going to have the patient lift up her shirt and we're just going to inspect the abdomen, and she has a flat abdomen and it is symmetrical, and we're going to listen to the bowel sounds. And each bowel sound we would listen for a minute. right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. So the patient has normal active bowel sounds, and they're not hyperactive or hypoactive. I am going to lightly palpate. You tell me if you feel any tenderness. No. Okay, and then we're going to do a little bit of deeper palpation. Any tenderness?
No.
Good. Okay, so now we're going to assess the patient's pulses. We're going to start with the carotid and work our way down. Brachial. Brachial, now the radial. Good, and then the femoral. Good. Good. And the popliteal. Good. Good. And the dorsalis tibialis. And the dorsalis pedis. So all pulses are 2+. Pulses are symmetrical on each side, and pulses have a regular characteristic, and they are approximately the same rate as when listening to her heart earlier. The next thing, while we're down here, I'm going to check the cap refill on her feet, and she has less than 3 seconds there as well. And then we wash our hands after we've touched the patient's feet to move on to other aspects of the exam. So now that we've assessed the patient's pulses, abdomen, lungs, and heart, we will, while she's lying down, I'm going to go ahead and assess her ankle joint down here. So I'm just going to have her kind of move around, palpate this ankle, around down here, palpate the ankle, and there's no heat, crepitus, swelling, or tenderness. Correct. Okay. So with that, we have also noted no edema in any extremities. So I will have the patient move her knee up and down. Good. Up and down. Good. So palpate. No heat or tenderness or swelling, crepitus noted there either. So we'll have the patient up. And so now we're going, I'm actually going to have you sit down for a second, sorry. We're going to do the other joints up here. We're going to feel here, move around, feel the elbow, move around, feel the elbow, the arm, hand. Good. So no heat, swelling, crepitus, or pain noted in those areas either. We did the knees, we did the ankles, and we will assess the patient's strength now. I'm going to have the patient put her arms up like this, and I'm going to have you push against me. Good. And have you put your arms like this, push against me. Good. Okay, good. I'm going to have you put your hands up, push against me. Good. And against me. Good. And then for knees, I'm going to have you do the same, push against me. Good. Good. And push against me. Good. And then we did the ankles already. So for muscle strength and tone, she has good tone. Strength is symmetrical in each extremity and intact in upper and lower. We've done the shoulders, elbows, arms, hands, and knees, legs, feet. Now we're going to have you stand up. We're going to do neck and hip. So for neck, I'm going to have you turn. Good. That way. Good. We're also going to have you look at the spine. Going to palpate. And there's no obvious masses. Crepitus, heat, swelling, pain noted there or in the neck as well. For hip, I'm going to have the patient this. Push down, good, and push down, good. And then I will have, you can go ahead and sit down. I'm going to assess the sensation in the extremities. All right, just tell me left or right.
Right.
Okay, soft or dull?
Sharp.
Down again.
Dull.
Good. And for this one, sharp or dull?
Sharp.
Left or right?
Right.
Sharp or dull?
Soft. Left.
Good. Perfect. So she has equal sensation in her upper extremities, lower extremities, and we will check the trunk as well. Left or right?
Left.
And sharp or dull?
Sharp.
Perfect. Okay, so now we've done that, we've listened, and looked at nails, skin, and joints, sensations, and I guess that will conclude our exam. Oh.